Hey everyone, this is Joshua McCrary, and this is going to be my presentation for the BARC assessment and teaching lecture. So during the BARC assessment, I kind of had an inkling of what type I am. I scored a good 15 on the read-write segment. I'm totally not surprised at that at all. I'd always been the student to complete all of the readings and look for more readings to add to like that base of knowledge. I'd always look for different types of resources. And so even when it came down to my notes, I would always just rewrite everything and do it in some kind of like chronological order or the systemic way of how I wanted it to done that made sense for my type of learning. And so everything had to be written out pretty imperfect. And so knowing what I gravitate towards with that reading and writing stuff, it kind of helps me incorporate those other types of learning needs for other people when I do these types of presentations. So when I do oral lectures like this, I need to make sure that pronunciation, communication skills are concise and very well and clean. And then you need to make sure you're including graphs and charts and different diagrams for all those type of visual learners. And then even for like the kinesthetic learners who might want to have their hands on something in class that you're going over, or to incorporate some kind of case discussion where they can kind of piece the pieces together and kind of create that whole big picture to look at. So for my syllabus that I created a syllabus for the Pathophys class in an undergraduate BSM program. And so to pull from that, I'm going to be giving a lecture on heart failure. And so just a big picture idea. Here's some goals that we want to accomplish with this lecture. We want to make sure afterwards the student can define what heart failure is, identify the different clinical manifestations of left-sided versus right-sided heart failure, and then want to have them be able to anticipate any kind of methods or modes of management for those patients exhibiting signs and symptoms of heart failure. So what is heart failure? Heart failure is defined as an inability to generate enough cardiac output, causing inadequate perfusion to tissues or increased diastolic filling pressures of the left ventricle, right ventricle, or both, so that there's an increase in the pulmonary capillary pressures. So basically that is just the heart can't squeeze or relax as well as it should be. Two of the most major risk factors are ischemic heart disease and hypertension. Some other risk factors include obesity, diabetes, renal disease, and even congenital heart disease that you'd see in the pediatric population. Heart failure can incorporate the left or the right ventricle or even both ventricles in advanced disease state. And when you're addressing the heart failure, you can kind of think as your left ventricle as your systemic pump and then your right ventricle as your pulmonic pump. And so when the systemic pump is failing, that means your left ventricle are going to have decreased cardiac output to your end organs, and that weakened function of the left ventricle is going to cause the volume in that left ventricle, which is also referred to as preload. All that preload is going to back up into the left atrium and then back up again into the pulmonary circulation, and that is you're going to get those pulmonary congestive signs and symptoms. As for the right ventricle, when it's starting to fail, you'll have decreased pulmonary blood flow, and then that RV preload is going to back up into the right atrium, and the result is going to the systemic signs that you see, the hepatosplenomegaly, the peripheral edema, the decreased pulses, cool lower extremities, all those kind of things. And so just remember, failing hearts, they don't like a lot of volume to pump, they don't like a lot of pressure to pump against. So preload isn't something they appreciate, and then afterload is something they are super sensitive to. Taking a closer look at left-sided heart failure, looking at the patho, getting in here, it can be categorized as systolic or diastolic heart failure. For systolic heart failure, there's decreased contractility, so there's that decreased squeeze that results in a high left ventricular preload that results into dilation of the left atrium, and then that starts to dilate and then goes back into the pulmonary bed. If there is high afterload, which is that pressure the ventricle has to fight against, such as hypertension or peripheral vascular disease, this is going to increase the workload of that left ventricle, which results in hypertrophy and enlargement of that ventricle. So it leaves you with this really stiff, weak chamber that cannot pump or relax as it really should. As renal perfusion diminishes when you have decreased cardiac output, you're going to get activation of the RAS system, and then your sympathetic nervous system is also going to start to respond. This is going to increase your preload and increase that afterload that we talked about to help preserve that renal function and kind of increase that renal blood flow. And then that's just going to contribute to more damage to the heart. But then on the flip side, if you look at diastolic heart failure, that's pretty much just a stiff ventricle that can't really relax to allow normal LV filling, but it still has normal LV contractility. It just doesn't allow for proper filling to get great cardiac output. Major causes of diastolic heart failure include hypertension-induced myocardial hypertrophy and then myocardial remodeling. Other causes such as aortic valve disease, mitral valve disease, and then diabetes also play a role in the disease. And then likewise with systolic heart failure, there's also activation of the RAS and the SNS symptoms, which results in more injury too. Clinical manifestations that you'd see for left-sided heart failure, you can kind of categorize these as your systemic signs or your pulmonic signs. And so the systemic signs, you're going to see those diminished pulses, poor capillary refill. If the kidneys start to take a hit, decreased urine output, patient will complain of being tired all the time. You might have hypotension or, depending on hypertension, depending on the underlying patho. They're going to have peripheral edema and then additional heart sounds. So that's going to be like that S3 gallop. But for your pulmonic signs, your patient is going to be complaining of dyspnea, orthopnea. They're going to have that pulmonary edema, which is that pink, frothy sputum that they're going to hack up. All that's going to contribute to pulmonary congestion. They're going to have pleural effusions. When you auscultate, there's going to be inspiratory crackles, and they might have some cyanosis present. And then other signs and symptoms that are going to help confirm this diagnosis with decreased cardiac output is cardiomegaly on echo, and then serum levels of BNP, which is secreted by the ventricles when they start to dilate and fail. Management for the left-sided heart failure, you're really going to want to interrupt that whole cycle of diminishing contractility and that increasing preload and afterload that we talked about. You want to provide oxygen to increase the O2 delivery to the cardiomyocytes, and then nitro and morphine are going to help for venodilation to reduce your preload. Diuretics are also going to help to reduce preload, so Lasix, aldactone, that's going to reduce any of the volume returning to the heart, and also diurese any kind of pulmonary congestion that you might have. Things that are going to reduce your blood pressure and bring down that afterload are things like ACE inhibitors, ARBs, beta blockers, but just be careful when you are administering these types of medications because they can cause bradycardia and hypotension. And then another thing that's all of our heart failure patients are going to want to be on is a heart healthy diet. So that's going to be like a low sodium diet to prevent any type of fluid retention, holding on to fluid, increasing that preload, and then it's going to regulate that blood pressure too. So now that we've finished with the left side, let's transition back to the right side. So for right-sided heart failure, basically the right ventricle is unable to provide adequate flow into the pulmonary circulation. When the left ventricle fails, this causes backup into the pulmonic system, increasing the RV afterload, straining the right ventricle to effectively pump into the pulmonary circulation. As that ventricle is poorly prepared to compensate for that increased pressure, the ventricle dilates, then begins to fail and can't contract or relax as well as it should. Of course, when it can't do that, this causes the volume to back up to the right atrium, and then it backs up to the superior vena cava and inferior vena cava, and that's when you start seeing those systemic signs. But on the flip side, though, when there's RV failure with absent LV failure, this is usually attributed to underlying like pulmonary disease, so COPD, acute respiratory distress syndrome, or any like cystic fibrosis. And then other causes for RV failure could be pulmonary valvular disease, cardiomyopathies, and even any kind of ischemia or infarction. For the clinical manifestations of right-sided heart failure, you're going to see more of the systemic signs, and you are going to see pulmonic signs. One of the first signs is that you'll see is that enlargement of the liver upon palpation. Your patients will have increased weight gains, dependent peripheral edema, diminished pulses, cool and pale extremities, JVD distension. They might some anorexia, and then they're going to complain of gastric fullness or bloating. Management for the right-sided heart failure patients. Treatment relies on management of the left ventricular dysfunction as previously reviewed, or if there's normal LV function, then you want to correct that underlying pulmonary patho that's going on that's increasing that RV afterload that it can't pump to the pulmonary bed. So you're going to use diuretics to reduce the preload. You're going to use those beta blockers and those ACE inhibitors to help reduce that afterload and bring down that SVR and bring down the blood pressure. And then, of course, like I mentioned, correct underlying pulmonary disease if it's with normal LV function. So now that we reviewed the whole patho behind it, signs and symptoms, and proper ways to manage these types of heart failures, let's kind of break up into groups and help apply these concepts to real life patients we might interact with. So if how would you be able to effectively communicate to your newly diagnosed patient what left-sided heart failure means? Because that is a scary term. Other things I want you to think about are, you walk into your room, you introduce yourself to your patient, and then you go to start your assessment. What are those signs and symptoms that you should kind of start picking up on if they're going to start exhibiting those heart failure signs? And then other things I want y'all to group together and talk about are, when you manage these patients, what are some of those things that you can expect to do, or medications to be prepared to give? And then if you have anything else, please let me know, any questions or comments, anything that I need to reiterate or go over in more detail pertaining to this lecture. Please don't hesitate to reach out if you need anything. I have my email and my cell phone listed in the PowerPoint. And thank you for taking the time to listen.